Hello everyone and welcome to session 12 of our course on refugees' health. Our topic this week is an interesting but critical one. It's about the ethics of conducting research in humanitarian and conflict settings, a topic that usually doesn't receive enough attention during the process of response to the refugees' health needs, or at least not always in the right way. Our objectives for this session will be to explore the ethical and accountability issues associated with refugees' health in a humanitarian response package and to examine the role of advocacy in addressing health needs of refugees. You may remember Nuremberg Code, the ethical norms and standards for medical research that have been established after the Second World War. In summary, there are 10 elements of this code. First, voluntary consent is essential in any research. The results of any experiment must be for the greater good of society. Human experiment should be based on previous animal experimentation. Experiments should be conducted by avoiding physical and mental suffering and injury. In addition, no experiments should be conducted if it's believed to cause death or disability, and the risk should never exceed the benefits. Moreover, adequate facilities should be used to protect subjects, and experiments should be conducted only by qualified scientists. Finally, the subjects should be able to end their participation at any time, and the scientist in charge must be prepared to terminate the experiment when injury, disability, or death is likely to occur. Despite arguments that it's unethical to conduct research on vulnerable populations caught in conflict, health research is essential to achieving the goals of promoting and enhancing the delivery of life-saving interventions. But what are the challenges that face this ethical consideration in a humanitarian and conflict settings? Let's check the list of the most important ethical issues and how can be affected by the conflict situation. The first one is the informed consent. It is an integral part of acknowledging the individual's autonomy and protecting those with diminished autonomy, like prisoners, refugees, children. In refugee settings, a high degree of illiteracy or mistrust of authority may mean that signing a consent form is meaningless or even dangerous. In a humanitarian crisis, an additional care must be taken to ensure that consent or refusal to participate will not affect the provision of assistance. The second challenge is the ethical review, or the IRB. As in many countries in conflict, the capacity of ethics review boards is highly variable. Some countries have no ethics review board at all. There is a big question on to what extent researchers must seek approval from other ethics boards, and to what extent this is practical or appropriate. Researchers should provide practical guarantees that the study population will benefit in some way from the research being conducted. As crises become more and more protracted, research fatigue emerges among vulnerable population that do not see any direct benefits with the improvement of their life conditions. It's also important to notice that all personal information collected from individuals and communities must be treated as confidential. This is particularly the case in handling protection-related data, reported violations, complaints of abuse or exploitation, and gender-based violence. Systems that ensure confidentiality are essential to prevent further harm. As research participants are traumatized and vulnerable, there will be more desperate for services or eager to leave their temporary living conditions. Researchers are often perceived as having power to effect change at both an individual and community level. This will have a substantial impact on the research process. In many cases, researchers are confused with the humanitarian workers. Refugees constantly approach researchers seeking assistance for themselves or their family, providing what's often compelling evidence of malpractice or neglect in the systems of protection that govern their lives. A set of 9 practical benchmarks for the ethical conduct of research was established by Médecins Sans Frontières and tested over a period of 18 months to assess its utility and feasibility. This framework has been found to be overall well adapted to different humanitarian settings where MSF conducts research and can be easily adapted to other humanitarian agencies. Public accountability of the research should be ensured through scientific and ethical review according to international standards. This may require the engagement of international as well as local ethics review boards. Within the humanitarian community, accountability must be tied to a specific set of actors, audiences, and objectives. One is held accountable to someone for something. Any discussion of accountability must begin and end with this question. As a result of our actions, policies, decisions, have we improved our ability to provide aid quickly, competently, equitably, and in dignified manner to those who most need it? Where threats to the affected population come from deliberate decisions, actions, or policies, humanitarian or human rights organizations should advocate for change to decisions, actions, or policies that threaten the rights of the affected population. But what is humanitarian advocacy? As per Save the Children, the term humanitarian advocacy encompasses not only advocacy in emergencies, but also advocacy conducted before and after crises and in situations of protracted vulnerability, suffering, or conflict. It can lead to change in policy or practice, holds duty bearers to account for their responsibility to fulfill people's rights in a humanitarian context, and ensure that the voices of refugees are heard and help influence decision makers in line with what they want and need. The challenges that could face the humanitarian advocacy are: first, speaking out versus operational risk for organizations. Second, balancing short-term reactive advocacy with long-term proactive advocacy. Third, limitations on organizations' right to advocate. Fourth, the crowded policy environment for some context issues. And finally, the question is, are organizations able to present the advocacy needs of affected population? Humanitarian agencies are increasingly engaged in research in conflict and post-conflict settings. This is justified by the need to improve the quality of assistance provided in these settings and to collect evidence of the highest standards to inform advocacy and policy change. The instability of conflict-affected areas and the heightened vulnerability of populations caught in conflict calls for careful consideration of the research methods employed, the levels of evidence sought, and ethical requirements. Special attention needs to be placed on the feasibility and necessity of doing research in conflict settings and the harm-benefit ratio for potential research participants. Thank you for your attention.